Hello coders, welcome to Fast Coder 21 Medical Coding YouTube channel. In today's session, we are going to learn step by step cardiovascular system CPT coding for CPC same day surgery coders session 1. Among all surgery coding specialties, cardiovascular system is the most difficult coding system. In session 1, we are going to learn few procedure related to heart and pericardium. If you are visiting for the first time, please click on subscribe button to receive future updates. In order to get complete knowledge on cardiovascular system CPT coding, please watch this video until the end. And also please like, share, learn and comment. So basically in any type of surgery coding, like if you take ICD-10 PCS or CPT, in order to code surgical procedures properly, we need to have the good understanding of anatomy related to that particular surgery. As today we are going to learn about cardiovascular system. So before going to code selections, we will learn few anatomy topics related to cardiovascular system. Basically, we need to understand what is the importance of anatomical drawings. So for example, this drawing is related to circulatory system, arteries and veins. So by using the chart, you are able to code interventional radiology procedures. For example, if you take most of the IVR procedures comes under this area, celiac trunk, hepatic veins, renal artery, gonadal veins, and also most of the lower extremity interventional radiology procedures performed on femoral artery, femoral vein, popliteal artery, popliteal vein. So if you know this anatomy, you can code IVR procedures very easily. So if you take top portion here, subclavian artery, subclavian vein, cephalic vein, axillary artery, and basilar artery, mostly these are central venous procedures. They will be used for dialysis grafts. While creating dialysis graft or fistula, physician will use artery and vein and combine both artery and vein. Usually we'll call it as anastomosis, and they will create dialysis circuit. So for example, if you know artery and vein anatomy here, you can code thrombectomy procedures very easily. Basically, total cardiovascular system CPT codes ranges from 33,016 to 37,799. Among these codes, we have two sections. One is 33,162, 33,999 related to surgical procedures on the heart and pericardium. So then 34,001 to 37,799 related to surgical procedures on arteries and veins. So first we will learn surgical procedures on the heart and pericardium in this session. So now we will learn heart and pericardium. So code ranges from 330162 to 33999. So pericardium procedures starts from 33,162 to 33,050. So what is pericardium? So pericardium is a fibrous sac that encloses the heart and great vessels. So basically pericardium will protect the heart and great vessels. So peri means surround, cardium means heart. So pericardium is usually surrounded the heart in order to protect. And also pericardium helps heart in stable location in the mediastinum and also facilitates its movement and separate it from the lungs and other mediastinal structures. So what are the common procedures on pericardium? Usually we have pericardiocentesis and pericardial drainage as well as pericardiotomy for removal of clot or foreign body, creation of pericardial window or partial resection for drainage, pericardiectomy. So here physician will remove the pericardium using the cardiopulmonary bypass, and also we have resection of pericardial cyst or tumor on the pericardium. So what is pericardiocentesis? It is a first procedure in the pericardium section. So basically pericardiocentesis. Centesis means aspiration or removal of fluid, and pericardio means it is aspiration or removal of fluid from the pericardium. So we will usually call it as pericardiocentesis. So pericardiocentesis is a procedure performed to remove pericardial fluid from the pericardial sac. So what happens if the patient has fluid on the pericardium? So in order to get relief from pericardial tamponade, to correct hypotension due to decreased stroke volume from extrinsic compensation of the chambers of the heart. So in order to reduce pericardial tamponade, physician needs to perform pericardiocentesis. In pericardiocentesis, we have few codes including imaging guidance if performed, and also we have pericardial drainage with insertion of indwelling catheter, and also it's these codes are based on the age, and also we have pericardial drainage using the imaging guidance, and also we have code for pericardiotomy for removal of clot or foreign body. So like pericardiotomy means it is like creating the incision and physician will remove clot or foreign body from the pericardium. And also pericardiectomy. So basically removal of pericardium is called as pericardiectomy using the cardiopulmonary bypass or without cardiopulmonary bypass. Usually we will call it as heart lung mission S or cardiopulmonary bypass. And also we have resection of pericardial cyst or tumor. So these all procedures comes under 33,106 to 33,050. Now we will learn cardiac tumor. We have two codes related to cardiac tumor. So one is excision of intracardiac tumor, resection with cardiopulmonary bypass, and second one is external cardiac tumor. So we need to check the documentation. If the patient has the tumor, we need to check whether intracardiac or external cardiac. Based on that, we have codes. So cardiac tumor code starts from 33,120, ends with 33,130. Next, we have transmyocardial revascularization. Code ranges from 33,140 to 33,141. So basically, whenever we code any procedure in any type of system, we need to code the or we need to think the purpose of that procedure. So now we will briefly learn what is transmyocardial revascularization. So basically, transmyocardial revascularization, we will also call it as TMR or TMLR, is a surgical procedure that uses special carbon dioxide laser to shoot tiny pinholes or channels through the heart muscle and into the heart's lower left chamber. Usually, we will call it as left ventricle. So this type of procedure is required for the people who are having coronary artery disease. So what is the main purpose here? To creating holes. So because of that, the flow of oxygen rich blood to the heart muscle will be increased. Thank you guys. Thanks for watching this session. As you know, cardiovascular system is more complicated. So in order to learn perfectly, we will learn step by step. Please learn, like, comment and share Passcode 21, and also encourage your friends to subscribe to our channel. Happy coding guys.